Today on Alimentos y Emociones podcast, we talk to Dimitris Koutoukidis, who's a senior research fellow on diet, obesity and behavioral sciences at the Nuffield Department of Primary Care, Health Sciences, Medical Sciences Division at the University of Oxford. Dimitris is a dietitian, and his research focuses on testing how behavioral science can change dietary intake and improve outcomes for patients with obesity-related diseases. In 2017, he completed his PhD in nutrition, dietetics and behavioral sciences at University College London, funded by the UCL Grant Challenges. For his PhD, he adapted a theory-based behavior change intervention for endometrial cancer survivors and piloted in a randomized controlled trial. As a postdoc at UCL, he worked in 2 clinical trials of dietary and physical activity interventions in cancer survivors. Now funded by the NIHR, he is currently building a program of work on weight loss for the treatment of non-alcoholic fatty liver disease, and this work uses a variety of approaches such as systematic reviews, meta-analyses, observational analyses, and clinical trials of low-energy diets. Today, we're going to talk to him about interventions in behavioral interventions in fatty liver disease. Please remember to share this episode, subscribe to Alimentos y Emociones podcast, both on YouTube and Spotify, and leave your comments. Press the notification button and help us grow this channel. Hello, everyone, and welcome back to Alimentos y Emociones podcast. I am very happy to be here today with Dimitris Koutoukidis, who is going to talk to us about weight loss interventions for fatty liver disease. Hi, Dimitris. How are you? It's really good to have you here.
Hi, Claudia. Thanks for inviting me. It's a real pleasure to be here.
This is a really interesting subject, and I'm sure that I know that there are a lot of listeners there who are really interested in hearing all about it. But before we jump in, I kind of would like to start with, what your background is and how you got into all of this. So if you kind of can take us through that would be really good.
Yeah, sure. I did my undergrad in nutrition and dietetics in Greece, and since then I was quite interested in research. I did a couple of research placements in the Greek islands, consenting patients and taking diet histories and so on. So then I thought, okay, I'll do a master's to learn a little bit more about that. So I was fortunate enough to get a scholarship and go to UCL, and I did my master's there. And I wanted to continue for a PhD because it seemed like a very interesting and cool thing to do, especially because we really didn't have all the answers, and it seemed like we did need the research to help our patients and the public on the best ways to have a healthy diet and be more active. So I did my PhD. I applied for a PhD. I did my PhD there in healthy eating and physical activity in cancer survivors. And after that, I did a short postdoc at UCL, and then moved to Oxford to continue with my postdoc and focus on weight loss interventions for fatty liver.
Yeah, so you've been essentially working on weight loss interventions for quite a while now. And we met at UCL, with Becca Beacon, who we shared as a supervisor at the time.
Absolutely, yes.
Trying to finish our PhDs.
It's always so important to have like the right supervisors.
Yes, it is.
That kind of stuff. Yeah.
And then you moved from UCL to this amazing research center, in Oxford. Can you tell us a bit about that and what you've been doing there since?
Yeah. So I moved in at the Nuffield Department of Primary Care Health Sciences at the Health Behaviors team, which is led by Professor Susan Jebb and Professor Paul Avier. We have done quite a lot of work on weight loss interventions that are scalable for use through the NHS for the general public. A lot of their work had been, at the time that I joined, around weight loss diets and how we can have effective weight loss for as many people as possible. So I thought that this was a very appealing concept. And then they had secured some funding to do work on fatty liver disease. So then I started applying that for this, and I've learned I've learned quite a lot of things through that, and it has been a really enjoyable experience.
Yes, I bet it has. Where do we start when we start with fatty liver disease, and sort of maybe we can start with fatty liver disease, and then we can go on to sort of like the weight loss intervention side of it, and all the research that you've done, your systematic reviews and everything.
Yeah. So people, it's a disease that affects about 1 in 4 adults. So it is quite prevalent, not only in the UK, but also worldwide. I think we see not extremely different prevalence estimates across the world. And so fatty liver disease affects 1 in 4 adults, not only in the UK, but across the world. And we see that the prevalence estimates do not really hugely differ across countries. So it is a problem. It is a worldwide problem. It can cost a lot of money, especially because this can progress to serious liver disease, to liver transplantation, liver cirrhosis, and liver cancer. Now, of course, not everybody is going to progress, but it is a big risk factor. So I guess, this is how it all started, from getting the understanding of the prevalence. And the main contributing factor that we see on that is metabolic disease and obesity.
Yeah. So that's why the interest in trying to see whether weight loss intervention is going to have some form of effect.
Exactly. So at the moment, there is a big pipeline of pharmacological treatments that they're being tested to see if they are effective in treating non-alcoholic fatty liver disease and its several forms, but none of them have shown to actually be effective. And we do know that weight loss seems to be very promising on the grounds of that the obesity and the metabolic disease is related to fatty liver, and the mainstay treatment in the guidelines is around lifestyle modification. However, the question is, how do we actually try to achieve this at the population level?
Yeah, the weight loss, I mean, the weight maintenance, or both?
We have seen from one of the analyses I've run that the more weight you gain, regardless of your starting weight, the worse your chances are of progressing in terms of the disease. So definitely avoidance of weight gain is important, but in terms of weight maintenance after weight loss, the important thing is to first, I guess, achieve the weight loss before we start focusing on ways to maintain the weight. Okay.
So let me get the sort of picture. You've been working, you've done 2 systematic reviews.
Yeah.
Over the since 2019, and then last year, and then work that you've been doing still this year and publishing this year. Can you walk us through that and how you've managed to sort of paint a picture of what like weight loss intervention means, for people with fatty liver disease, non-alcoholic fatty liver disease?
Yeah. So essentially, this whole work started back in 2017 when we were looking at the clinical guidelines for non-alcoholic fatty liver, and we were seeing that there was no strong evidence that weight loss interventions are effective for treating non-alcoholic fatty liver disease, but there was quite a lot of literature around. So we thought that the best way was to try to summarize that. So that's why I did the 2 systematic reviews. The one focused on randomized controlled trials of weight loss interventions versus usual care or versus less intensive weight loss interventions. And what this found was that the people who were randomized to the weight loss intervention lost significantly more weight, about 3 to 4 kilos more. And then this was associated with significant reductions in liver enzymes such as ALT, AST, but also in the fat in the liver and the inflammation in the liver were significantly reduced. So from a non-alcoholic fatty liver disease point of view, the things that we care about in terms of monitoring the disease and in terms of seeing how the disease is progressing would be the liver function test, so ALT, AST, the liver fat, the liver inflammation, and most importantly, the fibrosis in the liver. So that's how much scarring there is in the liver. What we showed was that weight loss improves the liver enzymes, improves the fat, improves the inflammation, but there was no evidence that it actually improves scarring, and that's the most important thing to improve. So
if you try and get you try and get the weight loss, but there's no improvement in the scarring.
Exactly.
Or you achieve some form of weight loss without improvement to the scarring.
Exactly.
Okay.
So one of the main reasons for that was probably there were probably 2 main reasons for that. The one was that there was not sufficient amount of weight loss because it was only around 3 kilos, and therefore this is probably very small to have meaningful effects on something so serious as the scarring. And the second is that there was very limited evidence from trials that actually had gone and measured liver fibrosis through a liver biopsy, which is the gold standard measure of doing that. Because, of course, it's invasive, it's expensive, patients don't really like that. And therefore, you get into this pickle, if you like, where there is no evidence because it's very difficult to collect this data. So because of that, I extended the systematic review to look at observational studies. So these were typically studies of bariatric surgery or big trial. There was definitely one big trial where everybody got the weight loss intervention, so nobody was in the control group, and they had biopsies at baseline and at follow-up. And what it showed was that the more weight you lose, there was higher chances that your fibrosis might improve. So there seems to be a dose response effect, but it is small and it doesn't come from extremely high quality data at the moment.
Okay. So again, you have this situation where your first recommendation would be, once you get diagnosed with some form of fatty liver disease, non-alcoholic fatty liver disease, because the other one is like, a different issue, even though some of the treatments can be similar. When you have your non-fatty liver disease, right, would be not to gain any weight. That would be like the first recommendation.
Yes.
And then to try and lose some weight so that if you do have some fibrosis, then you could not reverse it, but control it.
Yes. The idea would be that if you lose weight, you probably are going to control it in a way that for some people it might regress and it might improve, and for some people we're just extending how long they will stay in the same stage and they don't progress to the next.
Okay, then if you have these weight loss interventions, There is a point where you just have to say, okay, what would be the best weight loss interventions that we could try and sort of manage for these patients? And what have you found there?
So what we found was that there was not a huge difference between the different types of interventions in terms of what they were able to achieve above and beyond the weight loss. So the important thing was that it doesn't matter whichever diet protocol or pharmacological treatment you follow to lose weight. The important thing is to lose the weight because that will be the main driver of draining the fat from the liver and helping the liver reduce the inflammation and maintain the scarring at low levels. So one of the ways that we thought this might be that might be a possible treatment was through a low calorie diet. So this has been tested in the general population. It has been tested in many other settings, in people with type 2 diabetes, in women before conception, in people with osteoarthritis, and so on. And they all consistently show the same amount of significant weight loss of around 10 kilos or so on. So we thought that this might actually be a good idea and a good treatment for this disease. However, there was a caveat here, because this is, of course, not the general population who is healthy at baseline. That these people have some form of damage in their liver, and therefore there has been some literature showing that extreme weight loss or rapid weight loss or fast, we had to actually do a trial and test whether this is a safe thing to do or whether we should actually not be recommending such a treatment in this group.
Okay, sorry, there was a little cut in the sound there. So can you just go over again what the recommend? You did a little trial. Could you just go over that again, because of the dangers of losing weight fast?
Yes. So we thought that the best way to lose weight was to try to lose it through the reason that we thought that was that the literature consistently shows that the weight loss that people achieve at 1 and 2 months is the strongest predictor of long-term weight loss. So it is very important.
Weight loss.
So exactly. So the more weight loss you lose at the beginning of the intervention, the higher your chances to maintain this weight loss in the future. And therefore, the question then becomes how you can actually try to achieve as much weight loss as possible within 1 to 2 months. And one way to do this is through a low-calorie diet, where we provide people with formula products that are nutritionally complete. They have all the minerals and the vitamins that people need, but of course they have much less calories than usual. They have about 880 calories. So we thought that this might be a good idea, but there were some concerns that this actually might not be a good idea, because there is literature to show that rapid weight loss can lead to worsening of liver fat and worsening of the scarring. So this is why we had to do the trial, and it was important to do the trial to see that whether this is actually safe or whether there are dangers around it, and we have to not recommend it.
And what did you find?
So what we found was that it actually improves the liver significantly. So we see significant improvements in the liver fat, in the inflammation, and in the scarring in the ways that we were able to measure all of those things without a biopsy. But everything has is pointing to the same direction, that the liver is improving. So it does provide us with very reassuring evidence that this is a safe thing to do, and it seems to actually have potential to reverse the disease. But we do need a bigger trial to be able to say that.
Yes. I mean, what would you say to, I'm thinking of, of several situations. One would be how difficult it is to lose weight in the first place and to sort of stick to any kind of diet. Two, how difficult it is to stick to, very low calorie diets, especially with, formulas and etc. And three, maybe that's something that you can apply in a system like the national health system, where you have a, sort of control. There's enough, I'm not saying there's all the resources, but there's enough resources to put these patients under these sort of like diets and set situations in a sort of more controlled manner. But what would happen, in countries or in places where that is just not possible, to be able to get their patients to go on a very low calorie diet for 2 months and then slowly wean them off?
Yeah. So first of all, weight loss is difficult. I mean, it is hard, and if it wasn't hard, we wouldn't probably be having this conversation.
Yeah.
So it is a very difficult thing. And therefore, what we have seen from all of our studies is that the more support people get, the better. Now, with the formula products, what they actually people find is that this is something that it's very easy to do because it's just a powder that you mix with water. You don't have to think about preparing, cooking, planning, buying food, all that sort of thing. Doesn't apply anymore. So it is just makes things very easy and convenient. So that's the positive side of it. On the less positive side, of course, you have less opportunities for social interactions, or you might find them a little bit more. You might find it more difficult going to a restaurant and so on. But of course, this is a period that is a very specific period. Is not something that happens for a very long time. So it is about trying to be concentrated on the effort for this short amount of period. And what we do see is that people do actually find it that they are able to stick to it. They are very, very motivated by the weight loss because as soon as you stick to it, you actually see the weight come off quite quickly. And then this essentially becomes a circle where you get a feedback loop of, oh, I've lost the weight, I can keep going. And it gives you this motivation that you are actually doing something and it is working. So that's that. In terms of the resources, now this is a very good question, and even in the NHS, you still have to show that this is cost effective because again, you don't have unlimited resources, and it is all down to how much cost you are going and how much quality of life you are going to, how much the quality of life is going to improve, how much this is going to cost, and how much less you're going to spend in future treatments because you have prevented the disease. So then it might be the case of modeling for each country specifically to see how this can actually work.
Yeah.
But certainly there needs to be an investment up front. But it might be that if this is so effective, as it seems to be from our pilot data, that this actually is going to prevent a significant number of events in the future, and which are all extremely costly. So it might actually save money in the long term.
Have you seen, or did you measure in your pilot study? I mean, a lot of fatty liver disease, non-alcoholic fatty liver disease is of unknown origin. And so you have this situation where it's what happened to me, or what did I do, in order to have this disease? So therefore maybe, or was it, what caused it? did I cause it? Did I do something wrong? Did I do something to cause my disease? And therefore, maybe the motivation to actually want to lose the weight or want to stop the weight from being gained might be higher because you have like a drive or something. I don't know. I'm just trying to imagine. Have you found any of this or measured any of this? How do you see the patient?
So this is the typical thing that we would see in clinic when people will typically get the news, where they will be very surprised because they typically link liver disease with alcohol and they haven't been drinking. So they're like, but then why would I have liver disease? And of course, for the majority of cases, this is a case of having obesity, having excess body fat, having type 2 diabetes, hypertension, which are all things that drive the disease. But the important thing there is to reframe this in a way that, okay, there's something that you can do about it, and there's something that you can do about improving your chances in the future. And I think this is what people do find motivating. The other thing that they do actually find motivating is when the weight loss occurs and you see significant changes in your liver, you actually do get motivated because you do see the changes in the liver and you do get the motivation to keep going.
Okay.
Because you see that it is working.
And in the trials, obviously, you have to adjust for, did they have sort of previous diabetes? Did they have, previous hypertension? Or did they just come into this from, no known causes? What differences do you see in those sort of in those different patients? Our study was quite small, so we haven't been able to do subgroup analysis to analyze that. But our data at the moment do not actually show that there is a trend. There seems to be, it doesn't matter whether you have type 2 diabetes or hypertension in terms of your liver disease and how this is going to improve. What we do see is that because people who go on a low-calorie diet, who are on medication for the diabetes or hypertension, they have to stop or reduce them. This is an additional motivation for them because they simply stop having to go, they stop the medication, and this is something that people are very keen to do. Okay, well, that's good to know, that they don't want to sort of like carry on taking the medication in order.
The majority of them don't. The majority of them don't. They feel much better off not having them.
So you've been doing, this is really interesting, from a point of view as like a dietitian, how you've been able to mix the whole sort of clinical side with the research, or more like you're a researcher, but you're also, in the hospital doing the work directly with the patients. What does your work days and, life look like?
So I think the important thing is to build collaborations with the right teams and in terms of the medical teams and the nurse teams that you need to work with. So in my case, this is the hepatologists that I work with, and I have been very fortunate to be able to be in the John Radcliffe Hospital and recruit people in clinic and see their progress as they go through the diet. So essentially, the way it works is that I will probably going to be in clinic a couple of days a week, then probably 3 days work from the office, looking at the data, analyzing them, writing the papers, and so on. And we do have a second dietitian who is actually providing the support and coaches the patients throughout the intervention, because of course, the one thing is having the formula products, but the other thing is that you do have the support, and that is very, very crucial, and you do need the dietitians to do that, because the period of the shakes is going to finish at some point, and then you want people to establish a healthy dietary pattern, and that's where we're best placed to deliver that.
Yeah, and even just the day-to-day of, like, I imagine having to drink a shake for 2 months and the boredom of that, and it's like, I want to eat a piece of bread right now because I like bread. I don't want to, so all that support as well that you have to get from the dietitian specifically, and like you say, the weaning period. Yeah. The weaning period. Where would you take this research from now on? What would what do you want to continue doing in this area?
So because we had such promising data from the first study, now we are doing a second study, which is again a small pilot trial, but this is in people who already have established cirrhosis of the liver due to non-alcoholic fatty liver disease. So what we're essentially trying to see is that when we go to people who have more severe disease, if this is still okay to do. So that's really exciting and still ongoing at the moment. And hopefully we'll be able to have a big trial after that.
Yes. Good luck with that. Dimitris, is there anything else that you would like to add? I mean, I'm sure we could carry on developing this, but this gives us a really good sort of, general picture of the work that you've been doing and the sort of interventions that we need for these sort of patients. Is there anything else you'd like to add?
I think that the important messages for people would be to try and find a problem that they're interested in, and it's something that also the society thinks it's an interesting problem, and try to work to solve it with the right team. And I think there are plenty of opportunities for dietitians to do that and to be involved in research. So the most important thing would be to just email somebody who you think is doing interesting work and get in touch.
That's how we did it.
Yeah, exactly.
we just emailed people who we thought were doing interesting work, and look at what's happened. Exactly.
I think this is pretty much, I guess, how I started my PhD, and yeah, me too. So no, that's actually really, really good advice. Yeah, thank you for that. I will put links, to obviously to the papers, these 2 reviews, and the latest work that you've been doing on this, which has just been phenomenal, the way it's also sort of, been recited and cited, etc. And if people want to get a hold of you, Twitter is probably your best. Yeah. That's where Dimitris actually posts quite a lot of stuff, and is, you're definitely busy on Twitter, which is nice to see. I like that. So thank you so much. Thank you for being here. This has been an interesting talk, and I hope to see, more work coming from that, or whatever you decide that you're going to carry on doing in the future. Thanks, Claudia. Thanks for having me. It's been really, really nice.
And I just want to tell everybody, please remember to click the notifications and press the bell, and send this episode to those, are interested in this, not only this line of work, but, maybe liver disease is not your area, but it might be, definitely a way of linking, dietetics to research and to see the outcomes. So thank you all for listening. And I remind you all that we continue to nourish each other. See you next time. Bye. Gracias por escuchar un episodio más de Alimentos y Emociones Podcast. No olvides dejar un comentario, suscribirte al canal y presionar el botón de notificaciones. Ayúdanos a crecer. Y recuerda, nos seguimos nutriendo.